complicated words, jargons that may not be quite, known to us. We're talking matters of scrotal swelling or swollen testicles. Someone asked a question, can a man with one testicle give birth? I don't know. The doctor is in the house who will let us know, dive us into it. But anyway, it's a wonderful one. Thanks for joining us. You can join us on our socials, both Instagram, X, YouTube, and Facebook. And just join the conversation just in case wherever you're catching us from. And any questions will be answered by the expert. You're watching the Mighty Health Morning and in Focus. Yes, Doctor. Good morning once again. Thanks for joining us.
Good morning, Mr. Chientumutesa Senior.
It has been long, Dr. Emmanuel Bokalo.
Yeah.
From Chagwe.
Yeah, true.
Chagwe to Chadondo. These two cases.
Chadondo, yeah. I am happy to be here once again, and thanks for hosting me.
Thank you so much. Do you know a place called Nantabulirirwa?
Yes, I know it. It's around Jamai, and then you turn on your
Bethany TV is coming over there to do some benevolence kind of philanthropic work. We are going to do some health work to paint zebra crossing at Nantabulirirwa there.
Yeah, I think
which has been a very, very black spot for.
So it's necessary because of the junctions.
Yeah, but also some in health, counseling, treating people, having some games as well.
Wow.
So people from Mukono, we are coming in your place.
When is that?
It's going to be next month.
Next month. Yes. I think I should be part of it.
Yes. Yes, 13th. I'll keep you posted, Doctor.
All right.
Doctor.
Yes.
Testicles. Today we're talking matters of testicles. Now we want to know, because when some people think when you talk about kidneys, you're talking about testicles.
Okay.
Yet these are two different things.
Yes.
Is there a difference between testicles and kidneys, or what are testicles? Maybe you can start from there.
Okay, in Luganda, I think it has one word.
Ensigo.
Ensigo. For the testicles in Luganda, they say ensigo zomusajja. Whereas it's sajja. Then they want to distinguish it from the kidneys and also the scrotal testicular, the testicles. There is a great difference, definitely. The kidneys have functioning of urinary tract that is quite distinct from the reproductive system of the man, the gonads, which are the scrotum, and the testicles. That's a difference. And one kidneys are not necessarily for reproduction, testes are for reproduction. And definitely also to make the hormone that makes a man look like a man, where you are, and your colleague who was here.
Okay.
That's what distinguishes you. The testicles and the production therein is what distinguishes you from her. So
in other words, without testicles, no reproduction.
You are not a man necessarily. But you could be a male, but
you could also put on trousers.
You could also put on trousers,
but not a man.
You may not function as so. So that's what we can create a layer, and the spacing, the positioning of those two, the testicles and the kidneys. The kidneys are in the abdominal covering, and the testes are in the scrotum. The kidneys are up in the abdomen. The testes are out within the scrotal sac, and the functions are quite different. So people should not confuse the two. Clearly, that's what I could explain in terms of the difference that we have and functionalities as well. Yes.
So these testicles, are they something to worry about? Can they be affected?
Yes. Any man who wants to create a generation out of him, biologically, not spiritually, but biologically, needs to understand the relevance of the testes and the testicles. Testes and testicles are one and the same.
Okay.
So any man who wants to have another generation, an offspring out of him, needs to take care of his testicles quite well. And the relevance of why the testicles are outside the body, away from the body, the real body build-up, is because the factory therein that makes the spermatozoa hardly needs excessive temperatures. Usually these ones are regulated, the temperature is a little different from the one of the general body because of that muscle, the deltoid muscle that helps it to keep in different shapes. If you've been observant, for those that have male children that are young enough, when it's so cold, the scrotum tends to be thicker.
Yes.
When it is hot, the testis tends to become elastic and then slightly elongate, and also the dangling also becomes a little more.
Why?
Because it has to regulate the temperature, and it allows the heat to be emitted out, and also to ensure that the spermatozoa and the factory that makes the spermatozoa is in the necessary temperatures that it has to be.
So the factory is in this scrotum?
That is the factory that... The way you look at Coca-Cola plant, as sophisticated as Coca-Cola plant is to make Coca-Cola, to make Zori, to make juices that you make made out of Century. Is it called Century bottling? To make the different brands of Coke. That's I don't know. I'm not here to market Coke. So is the scrotum. So the testis, it has the functionality of producing testosterone, the hormone that makes you a man, to make sure that the different ingredients come together to mix the cell that is called spermatozoa, which people call the sperm. Okay. So all that is within that simple looking structure, but in whole detail. And also the storage, after making it, it's not just swimming around there. It has to be stored somewhere within certain cells. So all those are in that complex structure called the testicles. So once you don't take care of it, like you asked a question, can it be affected? Yes, it can, because it's a system of its own, as small as it is. And it has vessels, it has blood vessels, it has carriers, it has conveyors, it has storage systems, it has drainages, it has a supply system of the arteries, it has a drainage of the veins, it has the epididymis, and also the vasa deferens. It has the transport system where the sperm comes from and then goes through the...
If producer could get me the picture that Doctor would demonstrate this.
So people need to understand that anywhere around there, all that structure can have an effect. And once the structure is having an effect, probably it can reduce the functionality of the testis. And somebody can easily become challenged if any of those have an issue, and that's where we shall dive into what causes the swelling. I'm sure you will ask me some of those questions in the meantime. So exactly, that's what the gentleman is producing. That cup, that cup, like the ones for the judges,
blue thing,
the blue, and then the transport system of the difference, the red. The red is where the vessels, the red and the blue, that thick blue, maybe purple, I'm not so good at colors. So those are the veins and the arteries that are either draining the testis or giving blood supply to the testis. It has to maintain blood supply, and it has to maintain a drainage system as well. So it's a complex thing.
All right. Now, what could be the major functions of these testicles?
Like I mentioned earlier, the major functions are two. One, to produce spermatozoa, not semen per se, but part of the semen.
Come again on that?
Not semen, but sperm.
Oh, they're different?
There is a difference. It's like porridge. You see porridge? Porridge has sugar.
Yes.
And it has the content that we see as porridge. Okay? So semen is like the porridge. So the sperm is the sugar in there, that may not be visible, but when you test it, you can know that there is sugar in this porridge.
When you're testing, when you have porridge here, you say this is porridge.
This is porridge, but you may not know that there is sugar there.
You can't see it.
You can't see the sugar. So it's like men can produce semen and they don't have sperm in it. So they're two different people.
Really?
Somebody's releasing the semen, the content is all visible, and when he's ejaculating, the ejaculate has all the visibility of semen, and you might think that there is sperm therein, but there is no sperm.
And what could have caused the lack of sperm in the semen?
in the semen. It's when the factory has a problem. Probably it's no longer azoospermia. Probably it shut down. Okay. Like you might see Coca-Cola plant and it has shut down. There is a factory that we used to see here which had Vimto. I don't know when.
I remember in the 90s, early 90s. I remember we used to enjoy that.
It's not so early 90s. Don't make me look so old. It is late 90s. It should be.
Doctor, my parents, your friends used to tell us these stories. Okay, just kidding.
It's all right. It's okay. So, but at one point it closed down, but there was a name still up there, Vimto. So somebody could think the soda is being produced, yet it's not there. So is the thing. You can have the semen and it has nothing, but somehow it might make you think that.
Okay, so this semen, does it have anything to do with ejaculation, mature ejaculation, and what could you please help us? Someone is asking here, and I didn't want to leave this. What is mature or immature ejaculation?
I don't know what they call mature and immature.
Premature ejaculation.
Premature ejaculation, yes. It's like somebody releases semen in less than 3 minutes. Somebody is already ejaculating.
Okay.
Okay. Then somebody who does that above 3 minutes, we don't consider that really as a premature ejaculation.
Oh, okay.
So it's not about the content; it's about the timing.
Okay. Does that have any effect
on production?
On reproduction?
Yes. Not at all.
Okay.
It's just an erectile dysfunctionality that somebody releases spermatozoa or semen quite earlier than the necessary time, because of maybe anxiety, maybe because of the excessive sensitivity on his gland's penis, and those ones can be understood. Somebody has anxiety because probably they're meeting the first time, probably they have fears for certain things in the past, they are not used to their wives or their spouses, and then they do that, or else that the pelvic muscles could be having a problem, and they cannot really control. They are excited and all that. Like my colleague is actually putting it there. And definitely those ones, we really take them through some levels of exercise to ensure that they can try to control the ejaculation.
Oh, there's some exercises involved?
We can have some exercises such that, or else if it is an issue of sensitivity, then we numb the gland's penis with a certain cream that we can put such that it's not so excitable and somebody cannot easily ejaculate early. So
we're talking about the two major functions of testicle. You talked about
production of testosterone and also production of spermatozoa.
Okay,
so those are the two things.
You mentioned the spermatozoa, but you didn't mention the testosterone.
Testosterone is that hormone that makes you a man. It's a male hormone.
Okay.
That makes you have the development of the voicing, the development of the beards, the development of the male structure, the masculinity.
Is it attached to what we saw in X, Y, whatever, that determine the sex?
It's actually when a man, it doesn't, it's not chromosomal per se.
Okay.
Yeah, but testosterone, it's just the hormone that makes you look like a man. Just as estrogen makes women look like women, we have estrogen also in men, but it is so small and minimal. So for
us is testosterone.
For us is testosterone. For women, it is estrogen.
So, but there are women who can have a large amount of testosterone,
and they will appear like men. We've seen some. I think there is also
a famous athlete in South Africa
who is more like a man.
She was actually in and out of court, or whatever, whether they are testing whether you're a man or you're a woman and everything.
And it also depends. Some people have two reproductive organs.
Yes.
How do you call them in English? Maybe you're calling them, but there is a term I'm forgetting. But when hermaphrodite, somebody has two sexual organs, and at the end of the day, some will appear visible, but in terms of functionality, in terms of the hormones that make him a woman or man, others produce more hormones for a man, yet the sexual organ here appears to be like that of a woman. So those elements are there.
Okay, that is a complication,
It's
right?
a complication a bit.
Oh,
yeah.
okay.
So, but we have not come to discuss
Okay,
that.
anyways.
Even
So,
when
yeah,
I'm sure that,
testosterone, okay.
So the swelling, we go back to what causes swollen testicles.
Yes,
So,
what causes?
swollen scrotum. The swollen scrotum is either the content of the scrotum itself is the one that is having a problem, or it has been intruded upon by an external element, maybe fluid, maybe intestines, getting into your scrotum, or you've been traumatized at one time. Okay, so we can structure them whether they are infections that are coming in, whether they are mechanical issues that are coming in, whether they are there is an injury that has come to it. So we can section them and then we start looking at them individually.
Okay, who is more at risk? Is it the store or what is stored?
Both.
Testicle or scrotum?
Both can have an issue. Okay, so if the store, if once you see that the store is increasing in size,
swelling.
then you need to understand the content could be becoming bigger in there.
For how long am I supposed to know that now the issues are going out of hand?
We always understand our sizes individually, okay, because you can know what is normal.
Okay.
Okay, as you grow, you can know your size. Okay, so anything that is trying to expand beyond the normal that you've been having, then needs to worry you. The testicles don't have to have pain at one point in time. Okay, they unless injured or infected. Okay, and the scrotum should be in the regulated size according to how the person's anatomical functionality and structure has been for some time. For me, I can know my size. I'm sure you can also know your size, and also understand that between yesterday and today there is either an itching or a pain or an increase in size. So anything that triggers you to pay attention to it actually may make you think that something is not right in there. So what are we looking at?
Causes.
With the causes.
Swollen testicles or scrotum.
If all of a sudden between today and yesterday, all of a sudden you find the scrotum swelling, and it has it's inguinoscrotal hernia, like there is a space that communicates from your abdomen to the scrotum, and it means that probably you were lifting a weight, all of a sudden a heavy weight like that, and all of a sudden your scrotum started to swell. Probably the opening in the inguinal region has allowed the intestine to go through it and then get into the scrotum. Okay, so there is intestinal, the gut is inside your scrotum, so there is a swelling. Okay, and when the doctor or any other health worker holds and touches it from the base and tries to reduce it, okay, it goes back, and when they tell you cough, then it comes out, then you have an inguinoscrotal hernia. Okay, that can cause you a swelling. All right, so that's what can cause. At times it becomes painful, at times it's non-painful. When it becomes strangulated and non-reducible, like it gets in there and then there is like a tape that holds it, like a rubber, a band that is holding it and it can't be reduced, then somebody has become complicated, and definitely it needs an emergency that you get into theater, and we ensure that is corrected.
Okay.
That is one size. Then there is this gradual painless swelling. Okay, you notice that I'm having no pain, but somehow the scrotum is increasing in size every other week, every other month. Okay, then probably there is fluid in there. Okay, and when you flash a torch through, for us you flash a light through, you can notice that there is fluid in here, or you can try to percuss it and notice that there is a bit of shifting within the scrotum itself. And at times it's one-sided. It's rare that we see it on both sides, but it's also possible that it's on both sides. Why? Because the drainage at the tunica vaginalis area, those are, you may ignore the term, it's not absorbing the fluid as in when it comes in. So usually that's where people do hydrocelectomy. You get in there, it's painless, but there is that swelling, gradual swelling.
Hydrocelectomy. What do you mean by that?
We remove the fluid and then turn the tunica and then try to ensure that the fluid that comes from the abdominal content is drained backwards. So that's the science. So that is one. That is the second one also.
The second one. Doctor, let's take a break.
Please.
When we come back, we'll pick it from the second one.
All right.
The second cause, then we shall go into those symptoms and we see, and also the treatment, how we can help someone who's watching in there.
Okay.
We're tackling what we call scrotal swelling, or swollen testicles or scrotum. Dr. Emmanuel Bokalo is taking us through. Is a reproductive health specialist, and we are diving into this. But let's take a break. When we come back, more of that.
Focus on Healthy Morning. Bethany TV for Health.
UNICAF is offering $1 million worth of scholarships for you to study online at one of the leading providers of online quality higher education in Africa. Earn a British bachelor's or master's degree from one of UNICAF's partner universities. The University of East London, voted one of the best modern universities in the UK. Liverpool John Moores University, the 4th best university in the UK, according to the UniCompare Top 100 Universities rankings. The University of Suffolk, proudly boasting a 90% graduate employability rate. Apply now. Join over 60,000 students from 170 countries around the world looking to improve their lives and careers. For more information, please contact us on our WhatsApp at 771 976 750.
The Higher Life, the era of the Word Revolution, with Apostle Dr. David Kunawa and Pastor Rita Bella Kunawa of Rivers of Life Assembly International, Boston, Massachusetts, USA. Streaming every Tuesday from 8 p.m. to 9 p.m. East African Standard Time, with the incorruptible, incomparable, and revolutionizing, life-transforming Word of God. Only on Bethany TV for Health. Exciting news for all viewers of Bethany TV. Bethany TV, the premier health TV channel in Uganda and Africa, and also your favorite TV station, is now on Star Times. You can now watch Bethany TV day and night, weekdays and weekends on Star Times, channel 271. Catch your favorite programs on health, wellness, entertainment, and so much more. Bethany TV is also available on free-to-air, GoTV, YoTV, Airtel TV, and Afro mobile apps. Not forgetting online via our website www.bethanytv.ug and social media platforms at Bethany TV UG. Bethany TV for Health.
Health Minutes on Bethany TV.
The postpartum period is the time after having a baby.
There's a period that follows childbirth, basically. Medically, we put it around the first 6 weeks.
Some women get the baby blues or feel sad, worried, and tired within a few days of giving birth. Here are a few tips to help you navigate the postpartum period. Drink enough water.
You'll be surprised what good hydration, or at least 2 or 3 liters of fluid, can do for you in a day in terms of improving how you feel within your body and improving your mood.
Sun exposure in the morning hours.
We always recommend that mothers go out and walk and experience good sunshine. One is it helps in vitamin D, which is a very important component of breast milk for your baby, but also sunshine will elevate your mood.
Have a social support system.
It is difficult enough to have a baby. It is even more difficult when you do it by yourself. So we advise mothers to surround themselves with loving people, helpful people, who will help them both in looking after their babies and also looking after them as they look after their babies.
Better healthcare for a better tomorrow. That was the Health Minute.
Bethany TV. For health. Focus. Focus on Healthy Morning.
Welcome back once again. Thanks for joining us. My name is Chin Tumutesasira Senior, and we're tackling scrotal swelling. And we've talked about the functions. Now we diving into what could cause this swelling. You could have been having, maybe you could have had someone who's suffering from this, having this perpetual swelling in their scrotum, and they're just perplexed. They don't know what to do, what goes on. The doctor is demystifying these mysteries behind the scrotal swelling. Doctor, we talk about two causes.
Okay.
The second
one is what we've been discussing, and that is the hydrocele.
Okay.
It's fluid filled into the scrotum. It's in there, and it's painless. It is
hydrocele yempanama.
Checho mu Luganda. Yes, checho. And I've seen some people here in Kampala streets moving around. So I've seen them, and usually they come to me asking for money. I tell them, please come, I go and help you. I remove that fluid, and somebody just moves away thinking that it's a money-making venture. I've seen quite a number on the streets of Kampala.
It's treatable.
Very much. Okay. Why not? Because it's draining the fluid and then ensure that the fluid doesn't collect there again. That is the science. Okay. So no much magic.
How do we ensure that it doesn't collect again?
We know how to do it once we open up the tunica, and then definitely we see how to make sure that it doesn't.
Okay, yes, the third one,
collect again.
the cause of the swelling.
So others are testicular cancers.
Okay.
Okay, and most people don't understand this. At times you are not sure it's not fluid. It's not fluid. It's not the hernia, but something is swelling in there. And definitely we only can confirm that this is a testicular cancer when we get a biopsy, and then we do a biopsy, we get some bit of flesh out of it, and then we can make a conclusion that probably there are cancer cells in the testicular area.
Why is that thing red, everything?
This could be coming from the anatomy book and the Atlas of Anatomy.
Okay.
Okay.
Right.
Abnormal and normal. I want to see, yes. You see the red, the white on the other side. I don't know what he was pointing out for. Is that fluid? The hydrocele that is actually mentioning here, that is fluid, and on the normal there is no fluid flowing. Okay, so that's, you see that the fluid on the abnormal is covering part of the vessels and also the part of the vasa deferens and all that.
Actually, even the abnormal is swollen.
Exactly, it is distended. Yes, it is distended. So the testicular cancers that we've talked about, it is also possible that because there is excess production of testicular cells without control, definitely it increases in size. Others are infections. Infections could be that word. Yes, we could be having an infection of the epididymis. We could also have the infection of the testis itself. You could be having either an otitis. Otitis is the infection of the testis or the testicles, and definitely, usually, for example, when the skin has cellulitis, okay, it swells a bit. You've seen some people. My colleague is pointing at a cancer of the testis, probably, and that is not a good sign. Once you see that, and there are masses that are developing and they are not well defined, probably somebody has a cancer, and that is on the right of your screen, and the left of your screen is pretty something that is not something to worry about. The smoothness, just as he has pointed out, we are going back to the cancer of the testis, as he's pointing out. The testicle layers have to be smooth. You touch them and they are smooth, apart from what you see on the top, like judges, how do you call that? The heart of the judge or whatever, that white thing. Apart from that, if it becomes rugged, then probably you're having a challenge, and somehow you're losing the structure of the testis. Back to orchitis. Yes, orchitis is inflammation of the testicles, and like I was giving an example, once you have a cellulitis infection of the cells around maybe the hand or something that later turns into a boil, you notice?
Okay.
Definitely there is increase in fluid and also increase in shape and in size. It is losing its structure. So is orchitis. It can swell, increase in the expand, and also at one point it starts to hurt. Just as a boil in its primary stage, it hurts, and also secondary stage at one point, as it swells, it loses it numbs the nerves around it, and most likely you may not feel the pain at one point in time, but it is there. Okay. It is swollen. So then we have the epididymis, what he has been showing, that cup, like it can also become infected.
The reddish kind of thing?
Yeah, that red like. So once it becomes infected, epididymitis, probably it is a viral infection that is attacking it, or a bacterial infection that is attacking it, and definitely it will inflame, and it will swell, and it will hurt as well. So people need to understand, once that swelling is there and you're getting pain, most likely we are looking at either orchitis or epididymochitis or epididymitis. One of the three could be having an issue. So please visit the health worker and they diagnose, because what I've said can easily present the same way.
Okay.
And you're not sure that which one is which.
Is there a link between STIs, STDs with these swelling? Yes.
What I'm talking about could, the infection could have come from an STI or a UTI.
Okay.
Okay. It could be a gonococcal infection that has later gone into your testis. Okay. So that could be infecting you. And my colleague has just put it right there. And you see the red is the problem. The other one on the left is the normal. So once those are infected, you are you're getting a challenge. So this also, the gonorrhea, for example, if you have gonococcal infections and they have affected your testis, and they are also affecting your vasa deferens, that tube that moves the spermatozoa from the testicles through your urethra and all there. Once it gets hard, somebody can have a blocked vasa deferens, that tube, and then somebody makes spermatozoa, but it doesn't move, it doesn't cross. Just as you see blocked tubes for women, you can also have a blocked tube for a man. And somebody, once
enseke nga zizibikidde
olusekera omusajja nga luzibikidde
n'omukyala nga bwazibikidde
n'omusajja asobola naye nga bw'okola aspiration n'ojjamu mu spam, bw'otapinga awatuufu osobola okufuna spam mu aspiration yo, naye ate mu ejaculate ye mu semen we nga temuli nkwaso za musajja. So those ones can actually produce, can maybe under IUF or IVF, you can always help them to have a baby of their own. So the others could be injuries.
Bamusambye, bana bazanya ebikonde, oba teke, oba bana baffe batira okuzanya, omwana n'asamba munne mu busajja.
Yes, or straddle injuries, and mu busajja n'amusamba all of a sudden, and somebody has gotten a problem.
Lwaki we batukoonako gundi naddala gundi Mustafa twali naye nga basamba omupiira ne gumukoonako ebintu ne bibula biba birazeewa.
Okay. Now the scrotum is a very, very highly vascularized environment and very, very innervated. It has a lot of nerves, and definitely it pains a lot. And its security usually, it has no security outwards because it's not protected by any bone.
Okay.
And so the easiest thing is for it to go up into the pelvis.
Kagamba bintu babikoonako
ebigendako waggulu eno. And that's what causes pain for a person who is sexually aroused and they never have sex. Okay, so they get pain in the pelvis. because these ones keep trying to go back into the pelvis, and they somehow, since they are slightly
ekyo kibi omuntu okubeera nga ayingidde mu muudu ate n'atafuna kyabadde
n'akyamuka nti enjala bwekuluma olina okulya wano nkulaba oluusi osiiba naye ng'enjala ekulumye. So you don't just attend to any kind of biological pressures.
Okay, kati lwaki we babikubako kubanga oli yali alumizibwa nnyo mu staff obulumi abuwulirira mu lubuto?
Because the testes come from embryologically they come from around the areas of the kidney. Okay, so the nerve that supplies the scrotum is actually related to your vertebral column. So you can easily get the pain that is referred upwards. Some stuff yali mutuufu mwandi muyambeko wherever that story came from. Okay, so we were there. We were at the point of injury. Okay, injury at times that you've been kicked, you've had a straddle injury, or you get a testicular torsion. The testes twist, like you see a balloon and then you try to roll it like that. Okay, yes. So once it's twisting, definitely the epididymis, the vasa deferens, and those tubes, all the tubular structures that are within can easily twist, and definitely compromising the blood flow and drainage towards the testicle. And definitely it's starting to die. Okay, in the shortest period it can start to die off.
Injuries nazo za bulabe eri ensigo z'abasajja ezo.
Yes, you should not just take it lightly.
Kubanga olwo betuwulira nti bantulugunya bano mu nsi ezo
bataddamu kuzaala. Yes. Oli kasita kyenyolamuko, it may not take you 72 hours and the structures of the testicles are no longer as efficient. Yeah, because it is delicate. So people need to be cautious. That's why I think some boxers and some martial artists, I think they pad their martial artists batekawo wano ekintu ekikuuma. And men, I think in Kenya, there used to be an attack on men's private parts, and they started to get metallic with padlocks around here.
Kalinga kapampa naye akaliko kufuluwa kapampa akekyuma.
I think it was a way of safeguarding their genitalia.
Kakati bubonero ki bwensobola okutunulako Dr. Nendaba nti ntandise okulwala ensigo zange za wansi mu busajja?
Ekisooka okuzimba nga bw'okyogedde. Ekyokubiri obulumi. Yengeri no gye bitera communicating byebyo bibiri majorly oluusi n'ebbugumu eriyitiridde lyeri erikuleetera obubonero obwo. Oluusi ne bw'otandika okulwala STI, for example oyina past urethral discharge, otandikirawo okutandika okulowooza nti ndabika waliwo ekitatambula bulungi. Okay, so you need to be cautious of that. Kubanga bw'otakijjanjaba ekyo kitera okutambula ne kiva mu urethra ne kidda ewalala, kubanga tulabye nti enkwaso z'omusajja bwe ziva eno wansi era ziyita mu lupiira olwo oluleeta omusulo, meaning there is a connection somewhere that once that past discharge is becoming a problem, it can easily go through the very passage eyaleese enkwaso nezijja neziyingira mu factory y'enkwaso gyeri. So people should not be taking these things lightly.
Kakati okulwala kw'ensigo zino z'abasajja eza wansi eno mu busajja kulina engeri gye kukosaamu entonda y'omwana, quality?
Yes. Tukozeko semen analysis. Semen analysis kwe kutunuulira enkwaso z'omusajja ne tulaba bungi ki bwe zirimu era bwe ziba nga nnyingi zitambula ku speed ki gye tuyita motility, era bwe ziba zitambula ku zifiira ku rate ki. Okay. Ekirala nti structure yazo erabika etya. Okay, the structure and the morphology. Mu bigambo by'osimanyi lwaki abasawo tubeera n'ebigambo ebizibuzibu. So sperm yakulanga akakere buno obukere
akakulwe
anti
twabukwatanga
oluzungu ke kaki Is that a tadpole?
A tadpole.
It's a tadpole.
Yes.
That's how it looks like in its structure form. But when you look at it microscopically, there are more details. There's the centriole, the neck-like, and then the head, and then the tail. There is.
Akonga producer
perfect. That is it. So the centriole that looks like a neck that joins the head with the tail, and that is how it looks. But some abasajja abamu they don't have the heads. At times the head is off. At times the tail is off. Okay. So wano mu mutwe mulimu structures nyingi, mulimu nucleus, mulimu mitochondria, mulimu all details there in that thing that looks as easy as it is. Obulaba nti buswiminga n'emikira gyabo. Okay. So without the tail, it is redundant.
Ako kekakola omuntu ako?
Yoyo omuntu yennyini gwolaba. Watandika. Yes, that's half the human being. Actually, that is what fertilizes. Abantu balinga 8 awo bwe tulaba 1 2 3 4 5 6 7 8 9. There are potentials 10 potentials of having 10 pregnancies out of that. Just what you see on the screen. So that is a human being swimming towards the egg of the mother to start a life. So that's how the genesis of the person is like.
Producer so kumfunia kukatatukiride.
Perfect. Let's go there. Those are all details of the structure. The mitochondrion, the head, you see that? The middle piece, which is the centriole, the nucleus, all that. Now, so if somebody has not understood it, they think that okay, but that is the beginning of the life of a person. So if any of those structures are not there, the morphology is distorted, oluse emichira givuddeko, oluse emitwete giriko, and then abamu ku basajja abalwadde ebirwadde bino babeera n'enkwasa ezitatuukiridde.
Ebirwadde bino bye bikosa ekintu kino ogenda okulaba omuntu oguvuddeko, akakira kavuddeko, kakati awo kikosa entonda y'omuntu.
Perfectly so.
Omuntu ogenda okulaba ng'azaliddwa oba nga talina mukono, talina biki.
Ate olwo kijja wali mu development ekyo oluusi. Okay. Kuba katalina mukira tekasobola kuwuga tuuka ku jjiwe liri.
Kati kino kye tugamba obutaba na muto obutaba na mukira.
Kijja mu development yakyo.
Kulwawo kuzaala.
Oluusi omuntu amize ebikerenda ng'ali lubuto awo lwa mwezi gumu oba radiation emukubye, okay, ayinza okuba ayise mu byuma frequently nga bikola radiation. That's why pregnant women are not allowed. Bino
by'amasannyalaze buno obuuma buno bwa security bwe tuyitamu tukebera.
Exactly. Tubula abakyalo tubagamba temuyita mu byuma ebyo nga muli pregnant because it can affect the formation of your fetus. So in mu nnaku z'omuntu ezisooka lumu 2-3 hours ezo nga eggi lino litandise, eggi lifunye n'enkwaso, development eyo eri so fragile. Okay, the first 3 months, but also the first 1 week, the first 2 weeks, the first 4 weeks of that conception is critical for a person to take care of.
Dr. twetwogera ku ngeri ensigo zino eza wansi w'omusajja mu busajja nga zikoseddwa engeri gisobola okukosaamu enkwaso ze. Okay.
So ekyo ne tugenda deeper. So one thing that people need to take care of nti bw'oba okyayagala okuzaala ensigo zo making sure nti ziri mu temperature ntuufu ate ziri mu kifo ekituufu.
Twogera ku ngeri gye tukuumamu ensigo zaffe.
Ne mu nutrition yo ng'olya bulungi. N'ekirala nti teweeriraanya nnyo bintu by'amasannyalaze ku bifo eby'ekyalo.
Essimu zikubeera mu nsawo buli kaseera, laptop ekutuula kuno kwokolera, abantu batuuza ku bisambi. Zirina obukosefu engeri gye zikosaamu.
First ziyingiza amasannyalaze mangi ate ziyingiza ne bugumu.
Waliwo n'abantu abeebaka nga yeebasa essimu emusula wano temuvako.
Bannaffe abakola waliwo bitrera ebyedda ebyo byalingamu ebbugumu lingi wano ku engine. Oba okituulamu the whole thing is hot. At times ogenda okutuuka ewa mukyala wo ng'enkwaso ze wakoze ku olwo olunaku zonna zaafudde.
Nabadde nina ekirowoozo Dr. bwe tunaakomawo wiiki ejja omuliro omungi ogwo waliwo abantu abafumba ababeera ku muliro, bano bakuuku babeera mu kiyungu tafuluma, waliwo abantu abali mu byokero bino ebisaanuusa zaabu gamba kirina engeri kikosaamu.
You got it right. kuba temperatures z'enkwaso zirina okuba lower than the natural body temperature.
Underpanti tezina engoye
kale bannaffe abamu abambala bu underpanti
waliwo n'abambala obujini busikine
ne busindika scrotum ekisawo ky'omusajja ne kibutuuza ku mubiri
babukwata ettaayi ne babunyiga bwe bati
n'ogamba kati omuntu wa wansi mumunyigiriza mwababyogereeyo
gundi Mustafa kakati ate obupale buno bukwata ennyo
byonna ebituuza scrotum eno kyagifulumya ebweru such that yeesamba omubiri yejja ku mubiri gwonna yo ebeere
ekitegeeza omuntu bokisa zino omusajja kyandimukodde nnyo okusinga underpanti kati buno bwe bakola obuli skin obukwata ennyo bwe buti
ne busembeza scrotum ku mubiri omubiri ne gutandika okutapinga temperature ya scrotum netandika okutapinga temperature y'omubiri yet kyekyagifulumya ebweru yebeere ne temperature eyaayo.
Dr. tujjanjaba tutya nga tuva wano mu ddakiika
obujjanjabi nagezezaako obugatta ne cause in the beginning bweba hania nga bwe twakirabye okulongoosebwa okwo ne tuziba ekituli kiri ekifulumya ekyenda such that scrotum teddamu kuzimba because of gut ekyenda okuyingira. Bweba hydrocell nga bwe omukulu bw'abadde agituteerayo tujjamu amazzi gali ne tumakinga sure nti wali bwabadde gatuula tegakyasobola kutuulawo.
Hydrocell twagambye
y'empanama
mbadde manyi empanama liba ddogo
siddogo kubanga tulirinako
abamu balowooza nti liba ddogo
nedda it's not so. Abamu babeera ne ka filaria worm filariasis ne kagenda nga bwolaba elephantiasis ku bigere nako ne katuula awantu nga drainage y'omuntu tesobola kukola ki kubanga efulumya bulungi amazzi ago usually awo era omuwakali akatreatinga filariasis akawuka ako bwe kavaawo ne kafa n'amagi gaako then drainage neddamu bulungi. So bweba STI nga yalese obuzibu okulwaza maybe the epididymis, maybe the testis itself, then ng'ojjanjaba ekyo. Weba chlamydia, you treat and target the chlamydia. Weba gonorrhea, you treat the bacteria that has caused this problem.
Waliwo bye tulya emmere esobola okujjanjaba ensigo zaffe?
Esobola kugiwa bulamu. Kuba waliwo emmere erimu antibiotic effect, antiviral effects, ebintu nga garlic oluusi biyambako some onions, some veggies that really play a vital role in formation of this. Ne protein, because protein is the biggest content of the elements of the spermatozoa. Okay? Both plant and also animal content ezimu zisobola okuleeta ebintu bino okubanga bikola bulungi n'enkwaso zo nga nnungi. Yes.
Ewaffe bagamba emboozi teba nkadde.
Aginyume yagikaddiya.
Mu sekendi 10.
Abantu abaagala okubeera n'obulamu bw'enkwaso zaabwe obulungi beetaaga okwewala bino ebintu bye twogeddeko kuba enkwaso zo mwe muva obulamu bw'omwana wo addako. Away from the spiritual life by that biological content that is in there. So zikwate bulungi toziwa temperature eri unnecessary boba okola mu bintu ebimu bakuwa ekye bayita protective gears, personal protection ebibeere nga bikutaasa ku bbugumu eryo n'ebifo ebibeeramu ebbugumu eringi tolibeeramu nnyo, especially abali mu byokero, abali mu gold mines, abali mu ovens ezikola emigaati. Expose yourself to heat a short time, you come out such that enkwaso zo zifuna potential ebeera ng'esobola okuwangaala.
Tweyanziza tubadde ne Dr. Emmanuel Bukalu nga mukugu mu nkola ez'okuzaala. Erinnya lyange Kintu Mutesaasira Senior. Tukomye wano tujja kuddamu olunaku lw'enkya ssaawa ze zimu budde bwe bumu naye jjukira kuuma obulamu bwo ate kuuma n'ensi yo.
Focus on healthy morning.